Hi, everyone. Today I am joined by Daniel Garvin, who is a Pierrefonds resident. He is a retired paramedic. He was a paramedic for 33 years, who now volunteers, instructs, and is an honorary guard with Urgences-Santé. Um,
Excellent.
Thank you so much for joining me today, Daniel.
It's an honor to be here. Thank you.
Thank you. Now, we're here to have a very important conversation and sort of a startling discussion about the healthcare system in Quebec, especially after what you've been through. You had a very unsettling and nearly fatal health crisis involving your daughter on
Correct.
November 8th in Notre Dame de l'Île Perrot. So, if we're going back to the 8th, as a former paramedic yourself for 33 years, you are much more knowledgeable than most people in terms of healthcare emergencies. What signs and symptoms were shown that displayed the severity of your daughter's health crisis in that moment?
Generally speaking, anything that's abdominal is always taken as very, very serious because the abdomen is so diverse in human beings, but more so in females because of the reproduction area. So what I was looking at first was that my daughter was very pale. She was in and out of consciousness. And so I started thinking that this could be either a ruptured appendicitis, a twisted bowel, or something of that nature, because I wasn't aware at the time that she was pregnant. So I started questioning her while she was having periods of lucidity. And she mentioned to me that she was 6 weeks pregnant. Now, as soon as I had that information, with everything that I was seeing as far as her symptoms were going, I focused more on ectopic pregnancy with a possible rupture, which could be fatal. I mean, you're bleeding into your abdomen at this point because of the rupture. And so I immediately called 911, and that's how I went ahead and made my prognosis, if you will, of the situation.
Right. And so when you made that prognosis, you called 911. What was the response from the dispatcher when you called for help? And then the following medical responses in the events that followed that initial call.
Well, I primarily identified myself as a paramedic, telling 911 that I was in fact on scene with my daughter. Um, I gave them the crux of what was happening and the urgency in the fact that this was happening, because what I was thinking and what actually happened were two different things. I was of the mind that this would be regarded as what we call a priority one, which means full out, doesn't get any more of an emergency than this, and it ended up being classified as a priority three. Now, a priority three is still an emergency, but you don't have that urgency of a priority one, which is, like I said, the top of the line. Um, the dispatcher was very understanding, and the first thing told me was that it would be a 45-minute wait for an ambulance because there was no vehicles in close proximity to where I was. He acknowledged the fact that I was a paramedic and said that he would send help as soon as possible. After hanging up, I started to prepare my daughter for evacuation. We had to get out of there as soon as possible. And that's when the first responders arrived from Pancor. The first responders, I have nothing but accolades for them, because they responded quickly. The unfortunate side of that is that they don't have the ability to do anything invasive as far as treating your patient or obviously transporting your patient. So although they were there to give us support, there was really nothing that can be done to further the situation, to make it better. Um, I had already called my son-in-law, who works in town of Mount Royal, to tell him to meet us at the Lakeshore Hospital because of the situation was very grave. So at that point, when I asked first responders how much more time, and they said at least 30, 35 minutes, I called my son-in-law back and told him to come straight to the house from TMR, that we were going to be transporting her in his car. He had the time to come from town of Mount Royal to Notre Dame del Perrot, and there was still no sign of an ambulance anywhere. When he arrived, I again asked the first responders, how far is the ambulance out? Because they're in constant contact with the dispatch. So they checked and they told me at least 25, 30 minutes. So it was, forget it. We put Jessica into his car, and I'm sorry, I'm getting a little bit teary eyed. We
Completely
put
understand.
we put her in the back seat of the car, and we proceeded to the Lakeshore General. During the ride, there was I didn't see an ambulance anywhere on the road, en route, whatever. When we arrived at the Lakeshore, we brought her into the triage, and again, nothing but accolades for the people at the Lakeshore Hospital. I identified myself to the triage nurse as a paramedic, and so not to say that he wouldn't take other people seriously when they give a history, but when a paramedic gives a history, it's given in a medical sense, and it's a lot easier for medical personnel to understand what you're talking about. So I quickly went through what I thought everything was with the findings that I had, and we didn't have to waste time in triage. He believed me, and we immediately were evacuated to a room. When an ER doctor showed up, an emergency room doctor showed up, I explained the whole thing to the emergency room doctor as I had to the triage nurse. He as well took me at my word and ordered an abdominal ultrasound to see if there was any fluids in the abdomen, which I was sure that there were. The abdominal ultrasound was performed, and they found that there was a large amount of fluid, which we know at this point we knew was blood. So he called upstairs for an OBGYN surgeon to come down. Once it was confirmed with the OBGYN surgeon what was going on, he immediately ordered an OR stat, and Jessica was brought upstairs. They performed the operation in the operating room, and it took about maybe an hour and a half, 2 hours. The surgeon, when he was exiting the operating room, he came to speak to my son-in-law and myself, and he told me in confidence on the side, if we had arrived anywhere from 20 minutes to 35 minutes later, we would have lost not only the baby, but we would have lost my daughter as well. So my initial reaction was full on anger. I was livid, and so I went outside. I had to calm down, but reflecting on the situation and the way everything came out, my anger changed very quickly to a sense of gratitude that things did work exactly the way they worked, and everyone that was involved played a crucial role and didn't hold up the urgency. Everything was done as it possibly could have been done in that situation. So that's how things unfolded that day.
Right, and I can only imagine how difficult it is to relive all of these traumatizing events. So thank you for doing that, and any emotion
You're
is
very welcome.
completely understandable and
Thank you.
warranted. And so you mentioned that had you waited, even 20 minutes longer for an ambulance, it really could have been fatal for your daughter. Um, upon reflecting on it, how do you believe response times can be more efficient and life-saving in these situations?
That's a that's a rather difficult question because it is so complex. But um, the response that I could give you, Hannah, would be we need more resources. We need more resources on duty. And I know that what it comes down to is it's money. It comes down to money. It comes down to funding. And a lot of times people say, well, the more funds we put in, if we hire more people, though a lot of those people are going to end up sitting around waiting for calls because these situations, fortunately, are not something that happen on a fairly regular basis. They happen from time to time, but putting more resources out there may seem as though we're saturating the area with response personnel, but the goal of that is to have the response personnel, the reserve response personnel there when we reach crisis point like we did with my daughter. If we don't do that, if nothing has changed in that regard, we're going to see more and more cases such as this. And I shudder to think, how they'll turn out because being being a professional in the medical field and being a father, I was playing two roles at once. But the people that I'm thinking about are the people that are playing one role. A wife or a husband or a child. It could very easily turn out to be extremely sad.
Right.
Um, so again, just to reiterate what I was saying, I think the only way that we can possibly bolster our emergency services, unfortunately, it's that same old adage: we need to put more resources on the road. It's going to take more money.
Right. And in what ways did you, during your service as a paramedic, experience the burden of what you would describe as an underfunded healthcare system?
There's a lot of bugs, and I think the government is trying to straighten some of them out, but you have a lot of things that are considered as one would be poor coverage. And again, to bolster the coverage, you'd have to put out more resources. So there were many times when I was working that our dispatch would advise us that we were the only unit for the island of Montreal and Laval at any given time, which is frightening when you think about it. That means you could be driving full speed ahead to God knows what emergency, anywhere from Senneville to the end of the island in the East End, and anywhere from the south to the north. We covered Laval and Montreal. So I found that the coverage was not great quite often when I was working. I found that there's an awful lot of unnecessary transports, and not to put the burden on people that are less fortunate in this world, but a lot of people that are on the less fortunate end of the scale also tend to abuse the system. Um, Such as many times we would get calls from people who would ask to be transported downtown. When once they got transported downtown, before leaving the hospital, they would sign a refusal of treatment so they could leave the hospital. So basically, what we were was a taxi for them to get where they live to downtown, and then they would play the same ruse in the evening. They'd fall down on St. Catherine Street. They'd get picked up by an ambulance, and they would say that they were followed at the hospital closest to their home. They would be driven to that hospital, they would sign a refusal of treatment, and they'd leave the hospital before we even finished our paperwork. Now, we knew this was going on a regular basis, but we had no say. Our voice had no strength to it. So it didn't matter who we told or how many times we cried out about it. The problem went on and on and on and on, and I'm sure that it exists again today. So many resources are being taken off the road unnecessarily when those resources could be used for actual emergencies. Interhospital transfers is another thing. They do a lot of interhospital transfer for patients that are going for different treatments, such as chemotherapy or radiotherapy or what have you. These are largely non-emergency services where we're taking an ambulance out of service to transport a patient from one hospital to another for a treatment. Oftentimes, the team of paramedics, they wait until the treatment is done, put the patient back on their stretcher, and bring them back to the hospital. There's an awful lot of time in there where an ambulance and a team of paramedics is taken out of service when a private company or another type of transport company could be doing that. Um, Overcrowded ERs. I mean, there are so many glitches in the system, Hannah. Overcrowded ERs is a huge problem. Many times we would arrive at an emergency, we would triage our patient, and then the nurse would say, "Well, we'll get back with you in a minute to where the patient's going to go," and you end up waiting 2, 3, even 4 hours sometimes with your patient on a stretcher. You cannot transfer them because the hospital hasn't officially accepted them. So you have a team of paramedics standing in a hospital hallway with their patient still on their stretcher when they could be out doing emergencies. Um, there are so many lack of incentive for paramedics. Uh, they're paid a very low salary when they're hired. Low salary is not going to be an incentive to anyone. So a lot of young people coming out of the colleges, although they have the vim and the vigor and they really want to get involved, it's what they want to do. It comes down to reality. I mean, if you're not making a half decent salary, you can't live. You can't afford an apartment. You can't afford transport. Um, and so, unfortunately, today what we're seeing is a lot of these young paramedics are coming out. they'll work 3, 4, maybe 5 years, and then they move on. There's no such thing anymore as 25 years of service or 40 years of service. It doesn't exist. It's reality. I know it's the world, how the world works today, but it's a big, big problem for healthcare.
Of course. Well, thank you so much for your invaluable insight. I mean, frontline healthcare workers, all healthcare workers are indispensable for a better future in Quebec, a better healthcare system. So I really appreciate the insight you've given us, as well as your years of service as a
Thank
paramedic
you.
and what you continue to do today.
Thank you.
And just know that we're all thinking of you and your daughter and your family during this difficult time.
Thank you. I appreciate that. It's appreciated on behalf of my family. I thank you very much.
Of course. Thank you so, so much.
You're
And
very welcome.
I'm sure this will give a lot of insight to the West Islanders who can feel your pain and have perhaps experienced a similar situation as well.
I hope so. And as a parting piece of advice, if you will, I urge people to take a basic CPR course, first aid course, so that God knows when the moment comes, if you're found in a situation even remotely close to what I was found in, you want to have the most basic tools that you can do something uh, while you're waiting for an ambulance, or if you're transporting your family member to hospital on your own. To have the most basic of information is crucial, and it could be the difference between life and death.
Right. And I completely agree. I think I'm definitely going to go register myself for a first aid class. It's very important. So thank
It's
you for
very
that.
important.
So thank you so, so much. Once again, this has been Daniel Garvin and Hannah Johnston for the West Island News. Take care.